Hello and welcome to the overview of the emergency department. Here we will be learning the functions of the department, the team players in this department, how time can be managed well while training in this department, the roles and responsibilities of a house officer in the Department of Emergency Medicine, the expectations of being a house officer here, and last but not least, the pathway to specialize in this field for those of you who might be interested to understand the journey or maybe live one. Let's get started. Historically, casualty was the name given to the unit in the hospital that received and treated acutely ill patients. It was the most neglected clinical area of the hospital for many years since the country gained independence from the British rule in 1957. At present, the term Accident and Emergency Department is now known to the public who attend for any acute illnesses. Before the availability of qualified emergency physicians, the department was staffed by orthopedic surgeons, general surgeons, or generalists such as senior medical officers. The concept of emergency medical healthcare systems in Malaysia had existed since the 1950s. As in other countries in Asia, their functions and important contributions to the overall healthcare system have been much underestimated compared to the other specialties. It was after the Highland Tower collapse that emergency services began expanding its arm into disaster management and pre-hospital care, which are now fields that are getting more popular amongst doctors interested in emergency medicine. Postgraduate training in emergency medicine in Malaysia is still at its infancy. However, a lot of effort is currently being put into it to improve the training program. The establishment of a structured residency training program and a certified emergency physicians have revolutionized the emergency services that were neglected for so many years. An emergency department is also known as an accident and emergency department, A&E, maybe an emergency room, ER, emergency ward, EW, or simply as the casualty department. And it is a medical treatment facility specializing in emergency medicine, the acute care of patients who present without any prior appointment, either by their own means or by that of an ambulance. It can be largely divided into the triage counter, accident and emergency zones, the trauma OT, and the observation ward. Due to the unplanned nature of patient attendance, the department must provide initial treatment for a broad spectrum of illnesses and injuries, some of which may be life-threatening and require immediate attention. The emergency departments of most hospitals operate 24 hours a day, although staffing levels may be varied in attempt to reflect patient volume. Now let's dive into the function of the department. This department functions to provide urgent and semi-urgent attention to patients depending on their severity of the conditions. You can imagine the ED to be the entrance of the hospital. They also provide pre-hospital care for emergencies such as motor vehicle accidents, disasters, emergency calls from home. There are numerous staff and service providers working together in the medical team to ensure the objectives of the department are met. It is advisable to be well aware of who your team comprises and what are their respective roles as part of the medical team. The emergency team doctors are led by a consultant of the unit, followed by the specialist, medical officers, and you, one of the many house officers. It is advised that you introduce yourself to the ED team on your first day to the ED. The department head is usually a senior consultant. However, many hospitals in the country, especially district hospitals, have department heads who are young specialists. The head of department runs the department, essentially looking into the financial needs, resource needs, and overseeing the day-to-day activity of the department. The head of department is assigned to ensure that the department is running smoothly. They also play an important role as a representative of the department to important meetings, raise issues to the attention of the hospital director, and manage the department's budget to ensure adequate medications and equipment are available. Then we have the consultants, who oversees the patient's diagnosis, investigations, and treatment plans. He or she also helps to troubleshoot difficult medical problems. The specialist here is known as the emergency physician, who does rounds on a daily basis 3 to 4 times a day. He or she leads a team of doctors during the rounds. The specialist puts together the data presented to him or her and makes a reasonable clinical diagnosis. The ED specialist roles also extends to ordering relevant investigations, tests, imaging studies, procedures, which forms the basis of the investigative process of the patient, and all these have to be done as quick as possible. He or she is trained in delivering emergency resuscitative therapies to patients with life-threatening conditions as well. Next, we have the medical officers, who are the doctors who have completed their housemanship training. They make the bulk of the doctor's manpower and are stationed at various zones on a shift work basis. They oversee and they supervise house officers in simple procedures and clerking. It is advisable that the house officer brings forth any setbacks pertaining patient care or management that he or she may face to the medical officer in the ED before the rounds with the specialist. Next, we have the nursing staff, and the nursing staff in this department is also led by a matron of the department. The matrons are in charge of the nursing service division, and they are directly accountable for proper organization, direction, coordination, and nursing services. Matrons are in charge of the nursing service division and are directly accountable for the proper organization, direction, and coordination of nursing services. They are the nursing representatives of their unit to raise issues to the hospital director. We have the department sister, who organizes all nursing activities in her unit in accordance with the hospital policy and rules. She manages and arranges the rosters for the nursing staff team. She is in charge of ensuring all the records of the patient related to diagnosis, condition, and treatment, and ensure proper maintenance of the records. Then we have the nurses and the medical assistants who work hand in hand in every zone assigned to them. They provide direct patient care from intubation, establishing IV access, providing oxygen, and closely working together with the emergency physicians and medical officers to ensure patients receive the required care as soon as possible and disposition is carried out fast. Well, next we have the allied health professionals, who are the pharmacists. The ED pharmacists assist in dispensing medications to patients who are being discharged home from the ED, as well as providing consults on therapeutic drug monitoring, alternative drug therapy, double checking on dosages, and orders to prevent medication errors. They also provide suggestions to manage the current medication supply available in the hospital. They are usually stationed in the ED itself. Next are the clinical assistants and the lab assistants. Well, the clinical assistants are involved in a range of duties associated with the upkeep of the unit environment, cleaning medical devices, and to maintain the highest standards of cleanliness throughout. They are also responsible for giving out meals and drinks to the patients while they are at the ED and ensuring menu choices are completed and communicated to the appropriate unit. They are in charge of dispatching blood, urine, or stool specimens in biohazard bags from the ward to the lab counters. They also take care of patient lifting and transport. Then we have the lab technicians. The lab technicians set up and sanitize laboratories, prepare specimens, they match blood compatibility for transfusions to be done soon, they analyze fluid chemical content, and they collect blood samples and examine immune system elements. So you and your unit team highly depend on these technicians. Having a smooth relationship with them enables communication to work well to ensure specimens dispatched to the lab and processed promptly and results are communicated back to you as per the stipulated time frame. Then we have the telephone operators and the cleaners. Telephone operators are responsible for answering telephone calls, taking messages, transferring calls, and ensuring that emergency services are coordinated in accordance with the nature of the emergency. So you will be dependent on the operators to connect phone calls within and out of the hospital. Good communication can be ensured if you are courteous and concise with your calls. Then we have the support crews, who are the cleaners. They include the housekeepers as well as the linen managers. The role of housekeeping in this unit is to ensure that all areas, including the treatment room, the surgical room, the patient's room, labs, and the public areas are kept clean and sanitized. Linen and laundry services are responsible for providing safe, clean, adequate, and timely supply of linen to user units of the hospital at the right time as well. So, what are your roles and responsibilities in this department? Here, you will be of great help to the team in carrying out life-saving measures. Measures as such require a coordinated team effort, and here you will participate as an equal team member to carry out necessary procedures and therapies to assist with treatment. Next, you'd be addressing issues pertaining patients' complaints. You may undergo a brief attachment at the triage counter to understand the principles of triaging. Ambulance calls are also part of your responsibilities. House officers will be rotated based on a schedule to accompany the team that attends to ambulance calls. Here, you will get the chance of providing pre-hospital care and mastering life-saving skills. Lastly, decongesting the zones. Here, house officers are important to promptly check the patients which are brought in and finalize the plans with their medical officers and specialists. Time management is extremely crucial to reap the maximum benefit of training during housemanship. Let's look at a few general tips on how you could organize your tasks and use your time wisely. Tip number 1 is create a job list. Make a customized table to summarize your works or tasks systematically. Depending on which zone of the emergency department you are stationed at, the urgencies may differ. Nevertheless, it is best to ensure that work is carried out instantly with no delay so that the decision to admit or discharge the patient can be done fast. Cross out the tasks that had been carried out to avoid confusion between colleagues. And delegate tasks among you and your colleagues because cooperation between the senior and the junior doctors here is highly encouraged for efficient work to be carried out. Next, be always prepared. Learn up common conditions encountered in the ED from revision texts or from resources that we will be providing you here. Reflect on these cases in your shift as soon as you get home or once you're well rested. Case simulation and practices are encouraged to train your mind and physical state to be always prepared for any sort of emergency that calls in or is being brought in. Next, take turns with your colleagues if you wish to take a break and notify your team members or your senior colleagues on your whereabouts to ensure miscommunication is avoided. Use electronic or digital productivity tools, which most of you might already have in your daily usage devices, such as your smartphone, iPads, or a digital notepad. Utilizing the reminder, notifications, and planner apps or systems can not only save your time, but also ensures tasks are complete. So what is expected out of you? Prioritization is a skill you must have readily sharpened before you begin your work in this department. As cases are triaged, you will receive the patients at your respective zones and receive the handovers from the triage counter staff. Remember that working in the emergency department requires cooperation from everybody in the department, and you have a shared responsibility with everyone else towards your patients. Now, as you progress through this specialty, you find yourself having a keen interest in this field and plan to specialize in it. So how do you go about it? There are 3 entry pathways for attaining the qualification as a specialist in the emergency medicine field. The master's degree program through the Ministry of Education pathway, where here it is split into 2 for private or self-funding candidates. They can apply to the university directly through their postgraduate studies office, and the other arm is via application through the Bahagian Pembangunan Latihan or BPL, where one can then apply for scholarships. The MOH-FRCEM program is the 3rd pathway that one can apply through the Ministry of Health. The minimum training duration in the MOE Master's Degree Program is 4 years and the maximum is 7 years. The 4 stages of program corresponds to years 1 to 4. However, the duration of each stage may extend beyond a year depending on the trainee's progress. The minimum training duration in the Parallel Pathway Program, which is the MOH-FRCEM, is 5 years and the maximum is 7 years. The stages of the program follow the Royal College of Emergency Medicine RCEM UK requirements. Now, this is a list of recognized postgraduate qualifications in Malaysia, and these are the local and overseas programs that are recognized postgraduate qualifications to practice as a registered emergency physician in Malaysia. You may find this list on the Malaysian National Subspecialist Registry website. Now, let's take a look at the subspecialization opportunities for emergency physicians, which include disaster medicine, medical toxicology, critical care medicine, wilderness medicine, emergency ultrasonography, pediatric emergency, pre-hospital care, and traumatology. So in summary, we have looked at what does this department essentially deal with, who are the essential team players that make this department, simple tips on how time can be managed well while training in this department, understanding roles and responsibilities of a house officer in the Department of Emergency Medicine, what is expected out of you while you are on duty as a house officer here, and the pathway to specialize in this field upon completion of housemanship training for those of you who are keen to join this field of medicine. There are plenty of online resources available to assist with your learning process while you are in training as a house officer in the emergency department. You're encouraged to be resourceful as it makes your job much easier. Here, we will be going through some useful resources to aid your quest for department-related information and skills training. The first resource we have here is the Life in the Fast Lane site. It's an emergency medicine and critical care medical education blog which discusses many common conditions that present to the emergency department, ECG interpretations, scan interpretations, and this site also has podcasts which aids audio learners in gaining more information in this department. Next is the Academy of Emergency Medicine Malaysia, under the arm of Academy of Medicine of Malaysia. Similar to the other colleges, this college has latest bulletins and news as well as updated guidelines for the reference of doctors who may need them in their learning. This is the EM Basics podcast, which is a podcast channel providing detailed information on approaching emergency conditions that you may encounter in your rotation. And finally, we have the International Students Association of Emergency Medicine site. Here you can find numerous cited resources in many different formats such as journals, articles, podcasts, videos, and many more. So, we have finally come to the end of this session. We hope it was insightful and thank you for your time.